Hi, I'm Dr. Robert Mignone. I'm one of the physicians here at Becker Ear, Nose, and Throat Center. Obstructive sleep apnea, or OSA, is a very common yet serious sleep disorder. It's been estimated that approximately 20 million Americans suffer from obstructive sleep apnea, and up to 80% of the moderate to severe cases are actually undiagnosed. When left untreated, it can lead to high blood pressure, heart failure, stroke, and other cardiovascular problems. Obstructive sleep apnea is also associated with diabetes and depression, and is a risk factor in many traffic accidents due to persistent drowsiness and fatigue. Signs and symptoms of obstructive sleep apnea include loud snoring, excessive daytime sleepiness, frequent nighttime awakenings or awakenings with gasping or choking sounds, morning headache, difficulty concentrating, and mood changes. Obstructive sleep apnea is caused by partial or complete collapse of the upper airway while sleeping. This leads to decreased oxygen delivery to the brain. When the brain is oxygen deprived, signals are sent to wake up, and this manifests as frequent awakenings and resultant poor sleep. Obstructive sleep apnea is confirmed with a sleep study, which can usually be performed in the comfort of your own home. Once diagnosed with obstructive sleep apnea, a comprehensive treatment plan is then formulated. This plan is individualized for each patient and takes many factors into consideration, including their cardiovascular risk profile, severity of disease, anatomic abnormalities, sites of obstruction, and patient preference. The gold standard for treatment has traditionally been positive airway pressure devices such as CPAP. However, CPAP is not for everyone. Some people can have improvement or even resolution of their sleep apnea with weight loss or lifestyle changes. Others can benefit from an oral appliance, which slightly pushes the lower jaw and tongue forward and prevents collapse into the airway while sleeping. There are also several surgical procedures which can improve or even cure obstructive sleep apnea. These can be divided into procedures which affect the nose, upper throat, and lower throat. Nasal surgery, including septoplasty and turbinate reduction, can improve snoring and help increase tolerance to CPAP. Upper throat surgery addresses the palate, uvula, and tonsils. These procedures include tonsillectomy, uvulopalatal pharyngoplasty, or UP3, and palatal implants. Lower throat surgery addresses the back of the tongue. A more recent technology involves implantation of a pacemaker for the tongue. This upper airway stimulator is known as Inspire. Clinical trials have shown that Inspire is safe and effective, with patients having significant reductions in sleep apnea events and improvements in quality of life measures. In conclusion, obstructive sleep apnea is a potentially dangerous sleep disorder when left untreated. However, there are many treatment options which can be tailored for each patient. If you or a family member are experiencing any issues related to snoring or sleep apnea, please make an appointment to see one of the physicians here at Becker Ear, Nose, and Throat Center.